We saw COVID cases declining for several months as more and more Americans were vaccinated, but those cases rising again. Public health officials, some of them, say they are increasingly concerned about the Delta variant. As we want to say good morning to our health and wellness reporter, Sonia Azad, who's got some new data to share. Sonia?
Yeah, Mark, good morning. The latest from UT Southwestern shows a rise in both the number of new cases and this is the important part here, the number of COVID patients in the hospital right now. So UT Southwestern says its doctors and nurses are treating more than 800 COVID patients right now, and that number is expected to double by August 1st. In fact, there are as many people hospitalized with COVID right now as in early March. And if you remember, that's when vaccines were only available to select groups of people. So a lot of this, of course, is because, as you've heard, the more contagious Delta variant is circulating, right? And doctors are making it a point to identify how different it is when it comes to symptoms.
Like a common cold, so maybe harder to distinguish. With the other variants, the other strains, you could lose your taste or smell. That's not happening with the Delta variant.
So studies show most people getting infected now do have that Delta strain, which is why doctors are urging everyone to get vaccinated. Vaccines do protect against Delta. Now you might say, well, wait, Sonia, what about breakthrough cases where these fully vaccinated people are also getting COVID? Okay, we're going to talk more about that on Facebook Live starting at 6:30 this morning. I'll be with Dr. Mark Casanova. So he's going to be answering your questions about that. Plus, we're going to talk about the latest research, vaccines, masks, variants. We got it all for you. That's coming up at 6:30. Just head to our Daybreak Facebook page. All right, let's see.